Welcome to Knowledge Your Health. This is why you need essential first aid tips you must know. Whether you're at home, at work, or out and about, having basic first aid knowledge can make a huge difference in emergencies. Let's dive in. First, let's talk about CPR. Cardiopulmonary resuscitation can save lives in situations where someone's breathing or heartbeat has stopped. Remember, it's crucial to call emergency services before starting CPR. Push hard and fast in the center of the chest at a rate of 100 to 120 compressions per minute. Next, let's discuss choking. If someone is choking and can't breathe, perform the Heimlich maneuver. Stand behind the person and give quick upward thrusts just above their navel. This can dislodge the object blocking their airway. Burns are another common injury. For minor burns, run cool water over the burn area for at least 10 minutes. Avoid using ice, as it can cause more damage to the tissue. For severe burns, cover the area with a clean cloth and seek medical attention immediately. Nosebleeds can be alarming, but are often manageable. Have the person sit up and lean forward slightly. Pinch the soft part of their nose and hold it for about 10 minutes. Avoid having them tilt their head back, as this can cause blood to run down the throat. Lastly, let's cover fractures. If you suspect someone has a broken bone, immobilize the area and avoid moving it. Apply a splint to keep the bone in place and seek medical help as soon as possible. By knowing these basic first aid tips, you can be better prepared to handle emergencies and potentially save lives. Stay tuned for more detailed first aid techniques, and remember, your knowledge can make a difference. Now let's move on to mastering basic first aid. Additionally, let's talk about dealing with severe bleeding. Apply firm pressure to the wound with a clean cloth or bandage. If the bleeding doesn't stop, use a tourniquet above the injury. Another important tip is handling shock. If someone is in shock, have them lie down and elevate their legs. Keep them warm and calm until help arrives. Lastly, let's cover allergic reactions. For severe allergic reactions, use an epinephrine auto-injector if available and seek emergency medical help immediately. These additional tips can further enhance your ability to respond effectively in emergencies. Now let's discuss insect bites. For insect bites, clean the area with soap and water, and apply an anti-itch cream to reduce swelling and discomfort. Next, let's cover snake bites. If bitten by a snake, keep the affected limb still and below heart level. Seek medical help immediately. Poisoning is another critical situation. If you suspect poisoning, call your local poison control center and follow their instructions. Electrical shocks can be dangerous. For electrical shocks, turn off the power source before touching the person. Call emergency services and provide CPR if needed. Remember, being prepared and knowledgeable can make all the difference in saving lives. Welcome back to our Essential First Aid Guide. In this segment, we'll cover a few more critical first aid tips that everyone should know. Firstly, let's talk about dealing with severe bleeding. If someone is bleeding heavily, apply firm pressure to the wound using a clean cloth or bandage. If the bleeding doesn't stop, use a tourniquet above the injury, but only as a last resort, and make sure to seek emergency medical help immediately. Next, let's discuss shock. If someone is in shock, lay them down and elevate their legs to improve blood flow to vital organs. Keep them warm and calm until help arrives. Recognizing the signs of shock, such as pale skin, rapid breathing, and dizziness, can be crucial in providing timely assistance. Now, let's move on to allergic reactions. Severe allergic reactions, also known as anaphylaxis, can be life-threatening. If you suspect someone is having a severe allergic reaction, use an epinephrine auto-injector if available and seek emergency medical help immediately. Signs include difficulty breathing, swelling of the face or throat, and a rapid or weak pulse. Insect bites and stings can also cause discomfort and allergic reactions. For insect bites, clean the area with soap and water, and apply an anti-itch cream to reduce swelling and discomfort. If someone is stung by a bee, remove the stinger by scraping it out with a card rather than using tweezers, which can squeeze more venom into the wound. Snake bites require immediate attention. If bitten by a snake, keep the affected limb still and below heart level. Avoid attempting to suck out the venom or applying ice. Seek medical help immediately to receive the appropriate anti-venom treatment. Poisoning is another critical situation. If you suspect poisoning, call your local poison control center and follow their instructions. Do not induce vomiting unless advised by a professional, as this can cause further damage. Lastly, let's cover electrical shocks. For electrical shocks, ensure the power source is turned off before touching the person. Call emergency services and provide CPR if needed, as electrical shocks can cause cardiac arrest. By understanding these additional first aid tips, you can be better prepared to handle a variety of emergencies. Remember, your quick actions can save lives. Now let's move on to mastering basic first aid techniques in the next chapter. Hey everyone, I'm here today to give you a quick and essential guide on how to perform basic first aid. Whether you're at home, at work, or out adventuring, knowing these simple techniques can be a real lifesaver. So let's jump right in. First things first, let's talk about cuts and scrapes. It happens to all of us. You're chopping vegetables or you stumble on a hike. What do? Clean the wound first with gentle soap and water. Then apply slight pressure with a clean cloth to stop any bleeding. Once the bleeding has stopped, cover it up with a sterile bandage. Next up, burns. Cool the burn under running cold water for at least 10 minutes. This helps reduce swelling and pain. After cooling, cover the burn with a sterile, non-fluffy cloth or a special burn dressing. Moving on to sprains. If you twist your ankle, remember rice. Rest, ice, compression, and elevation. Rest the injured part. Apply ice to reduce swelling, wrap it snugly with a bandage, and keep it elevated. Choking is another emergency that requires quick action. If someone is choking and can't talk, cough, or breathe, stand behind them. Place your fist slightly above their belly button, grab it with your other hand, and give quick upward thrusts. Lastly, let's not forget about CPR. If you find someone unresponsive and not breathing, call for emergency help immediately. Then start chest compressions. Place the heel of your hand on the center of the person's chest. Interlock your fingers and push hard and fast, about 2 compressions per second. Remember, these tips are just the basics to keep everyone a bit safer until professional help arrives. I encourage all of you to take a full first aid course to be as prepared as possible. Knowledge is power, especially when it comes to health. There you have it, folks. Quick, simple, and life-saving first aid basics. Thanks for tuning in and stay safe out there. Don't forget to visit knowledgeyourhealth.com for more insightful health tips and tricks. See you next time.